If you have had a broken or dislocated finger or hand bone, then you may have had an operation to fix your bone or joint with wires. This video gives you information on how to look after your hand whilst you have the wires in place. Following the advice outlined in this video is crucial to getting the best result from your operation. The wires, called Kwires, are steel pins used to keep your broken bone or dislocated joint in your hand or finger in the correct position until your broken bone or dislocated joint heals. Often the Kwires are left protruding through the skin so that they can be removed at a later date without you needing to have another operation. The wires are usually removed 4 to 6 weeks after your operation. Do not panic. Removing the Kwires in clinic is a routine procedure for adult patients and is not painful, though it may be a little uncomfortable. The area where the pins protrude through the skin is called the pin site. It is important that you keep the pin site clean to reduce the risk of infection in the skin, bone, or joint. To clean your pin site, you should first remove your splint. Then wash your hands as normal with soap and running water. Please take care not to knock the wires, as this would not only be painful, but may also move the wires out of place. Try to gently remove any crusty material or debris which can build up at the pin site. You may find a Q-tip useful in doing this. Then let your hand air dry. Do not use a towel, as the pins may get snagged in the towel. Then you should reapply your splint. Please remember that you only remove your splint for cleaning your pin site and for doing the exercises your hand therapist has recommended. You should not use your broken hand for any other tasks until advised to do so by your hand therapist. If, however, you might have a pin site infection, you should seek medical advice from the hand surgery team as soon as possible. Ignoring your infection could lead to your bone or joint getting infected, and this can become very serious. Things that should make you concerned are increased swelling around the pin site area, the area around the pin site appearing red or inflamed, increased pain and tenderness, pus or any other discharge from the pin site, if you have knocked your wires, if your wires have become loose or wobbly, feeling unwell in yourself or feeling feverish. When can I drive? We advise that you should not drive whilst you have Kwires in your hand or finger, or if you have been advised to wear a splint, even after your Kwires have been removed. The time will vary depending on the injury, but is usually between 8 and 12 weeks. Your therapist shall advise you regarding this. Please bear in mind that if you're in an accident whilst driving with wires in your hand, or when you are supposed to be wearing a splint, your car insurance may be invalid. When can I return to work? This will depend on the type of job you do, the type of injury you have sustained, and how long the wires are in place. Your therapist can advise you regarding this. Good luck and help us to help you by looking after your hand.